Welcome to eLecture. This is for Welcome to eLecture. This is for week 3. Please follow through this eLecture and your attendance will be taken after you have completed the mouth quiz. In this eLecture, please read through the PowerPoint. The PowerPoint will include nurses' legal responsibility, which is the informed, expressed, implied consent. You need to know the differences. How about confidentiality? When do we keep patients' data and medical record confidential? It has to be at all times. The implications of technology using the electronic data record, will it help in terms to keep the patient's medical conditions in a confidential manner? Controlled medications like drugs like pethidine, morphine, are the healthcare workers abusing them, misusing them for their own use? There have to be a stricter guideline. Sexual harassment, there is a new act by the ministry, which is the Protections from Harassment Act, Chapter 256A. And lastly, we will go through about the Abortion Act. And this Abortion Act requested all patients to go through a counseling. So please take a look at the video. So for the learning objectives, these are by the end of this e-learning, you should be able to have an understanding of all type of consent, confidentiality, the control substance and abusing of drugs, sexual harassment, and the Abortion Act. There are 4 videos that you need to watch as you go through the slides. The first, the type of the consent, it tells you the importance. The video on the type of consents will tells you about the different type. For example, express consent, implied consent, and also informed consent. When you go to the video on the confidentiality, the video will emphasize on keeping patients' record by going paperless. So in electronic data record, it requires confidentiality as a whole team effort, including the doctors, nurses, and the healthcare professional. You will also view a video on controlled substances and abuses. So in this video, you will see that the hospitals is emphasizing on stringent and more stricter check on the drug supplies. Under the sexual harassment, please also watch the video where in the video it will tells you about the special clause from the government on the protections on harassment act, particularly on the cyber world. For example, using email to disturb individual, as there are an increased number of complaints on email received by individual. For example, a lady claimed that she has been receiving emails about a person wanting to know her and also know where she stays, and also write poems, email to her about love story and wanting to know her more. So this new act will help to prevent people from getting harassed via the cyber world, especially including email. And please also watch the abortions, the videos, and link on the Abortion Act. So in Singapore, we have Terminations of Pregnancy Act. Please read the Act. And in this new Act, it stated that abortion is not allowed if the pregnancy have progressed beyond 24 weeks. And it also, there is a compulsory counseling sessions to be done before every lady decides to terminate the pregnancy. Enjoyed this e-learning, and you can feel free to read through, and also especially please have more times to look through the video, and thereafter please complete the mail quiz. Your attendance will be taken after you have completed the mail quiz. Thank you.
As a registered dietitian, you have a legal and professional requirement to obtain informed consent for a client's nutrition assessment and treatment. Informed consent involves having a conversation with your client or their substitute decision maker. The conversation may include information about the overall nature of the assessment, treatment, benefits and risks, and options for alternative interventions. You also need to provide an opportunity to ask questions and have them answered, and you need to be confident that your client has understood all of the information. Let's call this the consent discussion. Informed consent can be express or implied. Express consent can be oral or written. In these cases, you have the consent discussion with your client and they consent by giving you a yes, I agree, or I consent response. That's oral express consent. If you provide your client with a consent form to review and sign, that's written express consent. But what about implied consent? Let's say you have the consent discussion with your client. Then, during a nutrition assessment, the client extends their finger when you bring out the glucometer, or they step on the scale when you ask to take their weight. This is implied consent. Although your client hasn't said, I consent, or signed a consent form, they have clearly demonstrated through their responses and actions that they consent. When should you rely on express versus implied consent? It may depend on how your client responds in a particular situation. You should also exercise professional judgment and consider organizational policies, the degree of risk to clients, and the nature and extent of the treatment. Express versus implied consent is simply about how your client communicates their consent. Regardless of how consent is communicated, it must be voluntary and informed. Consent is all about respecting your client's right to make informed decisions about their health. Clients should always understand what will be done to them. Wouldn't you want the same opportunity? For more information, visit collegeofdietitians.org.
As well as being clinical tools vital to providing effective and efficient care, health records are also legal documents. As an NHS Foundation Trust, we're governed by many laws and guidelines. Failure to adhere to our duties can have a huge implication for the Trust, including fines, disciplinary action, dismissal and, in some cases, criminal action. But more importantly, it can have a negative impact on our patients. The Trust is transitioning to electronic health records, but will still have to work with paper for a while yet. So here are some practical points to keep in mind when working with paper health records. The first thing to remember is that this is a team effort. It's everyone's responsibility to ensure we have the right information about the right patient in the right place. We're all equally responsible. If you're creating an entry in paper records, you need to 1. Print and sign your name. 2. Confirm your designation. 3. Where applicable, write your General Medical Council, GMC, or Nursing and Midwifery Council, NMC, number. And lastly, 4. Confirm the time and date of the entry. Notes need to be up to date, succinct, clear and legible. When working with paper health records, you also need to remember that there may be an accompanying electronic health record. This may be identified by a coloured sticker on the front of the folder. Always stop and think whether there might be electronic information to accompany the paper documentation. If you're not sure how to, or if you need to, check for electronic records. Then ask IG, or speak to the Health Records Management team. Loose sheets must always be filed correctly before sending the records on to another person or department, and envelopes full of loose sheets should not be sent to the health records libraries. Health records must be tracked using the electronic tracking systems. If health records cannot be found, then appointments or operations may be cancelled. We need to ensure that health records are stored securely and appropriately. They should not be left on the floor, hidden in drawers, or left out on a desk at the end of the day or shifts. Occasionally, paper health records belonging to a specific specialty are stored locally, or specific electronic information systems are used. These must all be registered with the Health Records Department. If you have health records that need archiving, you must inform the Health Records Management team so that the appropriate archiving arrangements can be made. Thank you for your attention, and please remember, we can only improve our health records if we all work together. If you have a question, don't hesitate to ask IG or speak to the Health Records Management team.
According to government data obtained by the Associated Press, federal authorities are stepping up investigations at Department of Veterans Affairs medical centers due to a sharp increase in opioid theft, missing prescriptions, or unauthorized drug use by VA employees since 2009. Doctors, nurses, or pharmacy staff at federal hospitals siphoned away controlled substances for their own use or street sales. Drugs intended for patients simply disappeared. A majority of staff implicated are within the VA system. That some VA hospitals have been lax in tracking drug supplies has only aggravated the problem. According to congressional auditors, spot checks found 4 VA hospitals skipped monthly inspections of drug stocks or missed other requirements.
New laws will soon be in place to give better protection to victims of cyberbullying and stalking. The Protection from Harassment Bill, to be tabled in Parliament on Monday, will make harassment an offence.
This 30-year-old, who wants to be known only as Mary, was a victim of cyber stalking 2 years ago. For 2 weeks, she was inundated with emails, Facebook messages, and even nasty calls and SMSs from a so-called admirer.
He would say in his message, like, I know where you are now, I know what you are doing. I feel so scared because I don't know whether he will come to my office or come to my house and did something stupid.
Till today, Mary's still scared because a stalker knows her, her family, and where she lives.
What the woman feels is a sense of helplessness because sometimes she doesn't go to the police because she doesn't think the police can help. But even those cases where they go to the police, under the current law, the police don't really have the powers to help them.
Current laws are vague when it comes to cyberbullying and stalking. Under the new bill, stalking, including loitering near a victim's home or messaging the victim every day, will be criminalized. The new laws make it clear that as long as the act is threatening, abusive, insulting, and causes distress to victims, it is harassment, even if it's done online.
In other words, what is not acceptable in the physical world must equally not be acceptable in the online world. So what this means is that there will be tools that potential victims can avail themselves too.
Now, because cyberbullying will be considered an offence, we're told that the new law will strike a balance when it comes to dealing with offenders who are children who may not know that what they're doing on Facebook or on blogs may constitute as harassment. So in such cases, the courts may issue community orders in the form of psychiatric treatments, counselling or even probation. The laws will also apply to acts committed from outside Singapore. For example, when an offender who's overseas stalks a victim in Singapore and knows that the victim was going to be in Singapore at the time of the offence. Penalties will also be enhanced to include jail terms. Observers say the new laws may be in place by the first half of the year. And for those who need help with harassment cases now, Aware is already running a helpline.